Hey guys, welcome back to our channel. Last time we talked about part one of the integrative medicine, which is the what and the why, what integrative medicine was and why we decided to go that route initially. And this is part two, and we're gonna kind of talk about the test that I had done and discuss what the integrative doctor mentioned about those tests and how we moved forward from that.
Right, so we mentioned in the last video about a questionnaire that this integrative doctor did when we went to establish ourselves as a patient with him. And it was a very long questionnaire. We're not going to put it right here in the video, but maybe we'll tag it on in the end somehow and just kind of scroll through it so you can kind of see the things that he looked into lifestyle-wise. But also, you know, he did a very detailed blood panel on Lindsay specifically. Kind of recap where we are. We started our, I guess, trying to get pregnant in March of 17, and we had seen, Lindsay's already seen 2 OBs, and then we established ourselves as a patient with this integrative doctor, and this is
May.
What's the date?
May of 2018.
May of 18. So we've gone a little over a year trying to get pregnant, and you know, of course, at the end of that year, started looking into this a little bit closer. And so these blood tests, kind of, you know, we were hoping would tell us exactly what's going on. And so I'll hand it back over to Lindsay so she can kind of talk to you about the blood tests and what those results were.
So I'm going to try my best not to get tongue-tied as I read through the things that he had tested. And I'm only going to do like the groupings. Each panel, I guess you could say, has individual tests broken down into that. So I'm just going to tell you, I guess, the overall grouping and then how many tests were within that specific things, I guess, that were checked.
Yeah, and overall, there's like 70 individual things that were tested for.
Right.
And that doesn't include a couple of the things that were already tested for by your OB, right?
Right.
So there's a couple of things that were already tested for. We already had the results, and it had been so recent before we seen this guy, so we didn't retest. But.
So rather than read them all off to y'all and butcher some of the pronunciations, I thought it would be easier to just type them out and kind of scroll through the list so that y'all could see all of the groups as well as each individual test within each group. And feel free to pause it and read them at your own speed.
Anyway, so there was over 70 additional things aside from what my OB, because my OB had done like a general, I guess, hormone panel on me. So he didn't recheck those because, like Jacob said, it was just within, let's see.
Yeah, he already had those results.
Oh, so that was September. I told you wrong on that.
Oh.
So the tests that I had done with my OBGYN were in May of 2018, and the tests that I had with the integrative doctor were in September of 2018. So
Okay, so it was about a year and a half after we had started trying.
Right.
That's what I thought.
Yeah. So I got the dates mixed up.
Yeah.
I told you my OB time.
Yeah, I was about to say, I thought it was like right after a year we started seeing those OBs.
Right.
And that was the case.
So the integrative doctor looked at all the tests, the 70 that he did, along with the testing that my OBGYN had done, which was more specifically like a hormone panel. And there were only really 3 things, I guess, that were glaring that he specifically talked about with us. And the first thing was my LH and FSH. And LH is luteinizing hormone, and FSH is follicle stimulating hormone. Got to say that 5 times fast. And in a normal fertile woman, usually the ratio is a 1-to-1 ratio. So your LH level and your FSH level are a 1-to-1 ratio. So that means like 4.1 and 4.2, or, they're very, very similar. So he mentioned to me that women with PCOS tend to have a 2-to-1 or 3-to-1 ratio. The ratio is off. So in women with PCOS or polycystic ovarian syndrome, usually your LH level is much higher than your FSH level. And your FSH level is important because that's what stimulates your follicles to grow, and that's what tells your body to ovulate. And so women with PCOS tend to be anovulatory because of that. And interesting enough, in our previous video, we had discussed my sister having PCOS, and that my first OBGYN said that I didn't have it. And so we had kind of brushed it off like, okay, well, they told me that I don't have it. And here we are with the integrative doctor saying, based on your LH, FSH levels, it's showing me that you have PCOS.
Well, he said based on that and your family history.
Right. Well, my family history.
With your sister.
And then I guess I'll lead into also my glucose levels. Mm-hmm. Because my glucose levels, when I had them tested with him, they were actually only 98, which if you remember, the reference range goes to 99 for normal. But as we mentioned, excuse me, integrative medicine looks for optimal health. And so 98 is awfully close to being out of that reference range. And so, he mentioned to me about my glucose levels, and he was the first person that mentioned metformin, which is a drug that diabetics take to regulate their insulin levels. And at the time, I said, that's not really something that I want to do. Like, I really want to try to just manage it through my diet.
And a lot of the reason was from that is the side effects, right?
Right.
There was some side effects to metformin that we weren't really that comfortable with, and your level was, again, right there on border. So we felt like we could, manage our diet a little bit better to kind of help those glucose levels get back.
Right. And so insulin resistance is another symptom of PCOS, which in the panel that he did, he actually did not check for insulin resistance. He checked my glucose and he checked my insulin, but those don't actually tell you whether you're insulin resistant. Fun fact. I'll get into that later because I actually just had it tested this year because I wanted to know for sure that I was insulin resistant, because that will, if you keep pushing your body and it's pushing out so much insulin to compensate, that's what eventually leads you to becoming diabetic. So,
your pancreas basically, works hard and works hard and works hard, and it can do that for a good while, especially while you're young. But as you get older, and that's why there's a lot of people out there that get into their 40s, maybe early 50s, and start. That's when they become diabetic, kind of later on in life. But it's because they've overworked their pancreas so much during their life that ultimately it finally gave up or partially gave up.
Yeah.
And they had to start supplementing with insulin.
Right. So the other test, or the other result that he brought up to me was my prolactin level, which was also on the panel that my OBGYN did. And I noticed that it was high. It was out of the reference range whenever I tested with her, but we never really discussed I guess, specifically about that. Because we went from seeing her to seeing this integrative doctor. And
So she never brought it up in your second OB.
she mentioned it was high, but I don't think, her not being a fertility specialist, I don't think she really knew
what
what
the significance
the
was.
significance was, or how that could be fixed. I mean, she's not an endocrinologist, and she doesn't specialize in that specifically, because it's part of the endocrine system. Even though it is a hormone, I mean, and hormones are part of the endocrine system, but
A dog here is being goofy on the ground.
anyway, so my level was 30.3, and the reference range for prolactin that they like to see you in is 4.8 to 23.3. So, like I said, I was 30.3.
Yeah, well, and that's, again, a wide reference range that they kind of put people in, but we know now that as far as, women who are trying to get pregnant, from a fertility standpoint, you really want to see that on the low end, extreme low end of that reference range.
Right. And if you know about the thing they say about nursing mothers not being able to get pregnant, although it isn't always the case, it's because they have high prolactin levels. So prolactin is the hormone that allows you to breastfeed. And it's located in your pituitary gland, which is in your head, in your brain. And so one thing that he mentioned to me was that he wanted to refer me to an endocrinologist because that my level was elevated. He wanted to be sure that I didn't have a pituitary tumor, because if I had a pituitary tumor, they wanted to go ahead and have that removed, which there is medication that can manage your prolactin. But if you have a tumor that is, constantly growing, you're going to have to slowly up your dose. It's not going to, getting rid of the tumor is going to fix the problem. And so, he referred me to an endocrinologist to go ahead and get an MRI to get that checked. And I guess that's kind of where the story ends with the integrative doctor. Was, he went over everything. He diagnosed me with PCOS based on some of my blood work and mentioned my prolactin levels and said, told me about the pituitary tumor that I could possibly have, which definitely was kind of terrifying once we found out that it's located in your brain, because not many people want to be told, oh, you could have a tumor in your brain. Obviously that's an initially terrifying kind of news to get, but the good news is most of them are benign. And so we will talk about, I don't know if Jacob has anything to add.
So the integrative doctor did talk about some other things, lifestyle changes, like we beat that dead horse in the last video. So we won't talk about that anymore. But of course, there's a lot of stuff that we had already done a lot of research on and kind of knew about. But he also did talk about the treatment, and one with the PCOS, just kind of managing some of those levels with just lifestyle changes and diet, and making sure that we're not overdoing it with the sugar and carbs and other things, which, as Lindsay mentioned, we had kind of already gotten on top of. And then two, going to this integrated or endocrinologist. And so we'll pick up the next video on that. And I know a lot of this stuff is just kind of mostly going to be all Lindsay. I'll have a video at some point that just kind of talk about the testing that I did. I could probably do all mine in one video. I got lucky. I guess I was pretty easy. But anyway, we'll catch you next time on that one.
And we'll also quickly scroll some of the or as much of the questionnaire as we can, just so y'all can see some of the questions of what he asked. And it was more than him just going over the blood panel. Sorry, Jacob's ending the video and I'm continuing to talk, but it was more than just the blood panel. He talked about all the questions, you know, the diet and lifestyle and me doing yoga and, you know, just the things that we are doing day to day. And so I don't want y'all to think, oh, well, they went to this integrative doctor and they only talked about
yeah. Well, that's a very good point. I'm glad you brought that up because, we did go through the results and we talked about this video being about the nuts and bolts of that. But he did very much mention, you know, lifestyle, stress management, doing exercise, you know, meditating, you know, just a lot of different things to kind of clear your mind, reduce stress levels, and all, because, you know, as we mentioned, and you know, I don't know that we have any you know, literature from him that kind of talks about the benefits of doing all that. I'm sure we did get some, but it's easy to look up online and just kind of and really it's easy to just do a yoga session or go get a massage or spend, you know, 20 minutes of meditation and just see how it makes you feel. You know, it's amazing. I mean, you don't really have to go to a doctor and read stuff to see the benefits. You just do it.
Right.
You know.
And there are lots of free resources too.
Yeah, you can feel the benefits right off.
Right.
So anyway, encourage you guys to do that. But yeah, this is where we're at in our journey. Year and a half in at this point, and then we're gonna go see the endocrinologist in the next video. So hope you guys enjoy, and catch you next time.
Talk to y'all later.
Bye.
Bye.
Put it back on the blue.
Apparently, I want to drink.
Oh no, bro. Oh no.
Fertilizing women.
Fertilizing women.
Fertilizing women. No.
I don't know that that's.
Yeah.